Hi, my name is Luis Garcia. I am a medical doctor, and I received my education from Boston College in biology back in 1997. Afterwards, I went to Colombia, South America, and received my medical degree from Universidad de La Sabana. And after studying medicine, I became involved with homeopathy, neurotherapy, chelation therapy, ozone therapy, homotoxicology, um, biological medicine, and other alternative holistic practices until I finally learned and started to incorporate biomagnetism or biomagnetic pair therapy. After becoming trained in biomagnetism, I soon realized and it became obvious that the benefits far exceeded all of the other outcomes that I had seen with my previous modalities in my medical practice. I decided to continue studying with the most prominent physicians from South and Central America in learning more about this therapy, and so ultimately and subsequently decided to return to the United States with my family and bring this therapy to North America. Biomagnetism or biomagnetic pair therapy is a revolutionary scientific and therapeutic approach that involves the proper placement of magnets, especially medium to high powered magnets, placed over specific areas of the body to help regulate pH or hydrogen potential. Through the use of magnets, you can move hydrogen protons and atoms around in the body, creating different energy shifts or movements of water, hydrogen, hydroxy ions that ultimately end up balancing your body's internal pH, creating a state of natural equilibrium whereby your organs, muscles, cells can then function adequately to restore balance to your body. It is believed that ultimately pH imbalances in our bodies combine and accumulate to generate different symptoms, syndromes, and health debilitating conditions. Therefore, by preventing these pH imbalances in our body and correcting them, we're able to provide the body the metabolic conditions necessary so that the body can ultimately end up healing itself. Biomagnetism or biomagnetic pair therapy was discovered by Dr. Isaac Gois from University Autónoma de Puebla. He discovered it over 25 years ago, and today it is practiced all over the world, in Europe, in South and Central America, here in North America, and it has been perfected over the last 25 years. And as of the year 2014, midsummer, it will be taught in medical schools in Spain and Mexico as a medical course. Magnets have a north pole and a south pole. Depending on which side or which polarity you use, you can either push away from, repel, or attract another magnet. Although we cannot see the magnetic field that these emit, we can certainly observe the effects of the magnetic field as it's able to push around molecules. If I place one of these magnets over a body part that has an acidic pH, it will cause a muscular contraction in one of the extremities, either the legs or the arms. If, on the contrary, it has an alkaline pH, and I place a magnet in that particular body part, it will cause a muscular relaxation, and we will observe an elongation of that body part. So if you zoom in over here on the feet and take a view from maybe this angle, we can observe how the patient's legs are symmetrical. We can observe an evenness here as well as up here as I'm holding her feet. Upon placing a magnet over a particular body part, we then observe how one leg has elongated, or there is a muscular relaxation, and we observe the right leg longer than the left. It does not matter if I shift her legs like this, we still observe the same length difference. Doesn't matter how much I pull or push, her legs are not going to go back to being even until I balance out with corresponding opposite magnet on the pair that will reestablish balance, thereby leaving her legs equal again. And so once the magnets are in place and the legs are back to neutral or even position, we have to leave these magnets for a specified amount of time in order for the magnetic energy to work and do what it needs to do throughout the body. A typical session lasts approximately 90 minutes, and during each session it is normal to feel different weird sensations traveling on or along the body. As you place magnets at different points, you'll feel either some numbness or maybe cold sensations or tingling sensations, and once again it's due to the movement of the molecules throughout your body. They'll usually last for 2-3 minutes and then disappear. You may also feel tired after the session. It's very similar to going to the gym. If you haven't worked out in over 6 months and you go back to the gym that first day, while you're at the gym you feel great, same as when you're getting this therapy done on yourself. You feel great, but the next day or for the next 2 days you're going to feel tired, same way that you're going to feel after the gym experience. So things to expect after the session are, once again, some tiredness, maybe some healing reactions such as temporary headache or lightheadedness, and these will go away within a few hours. And just like going to the gym creates hundreds of benefits for your body, so does this therapy. However, just like going to the gym, after that first initial visit to the gym, you can't expect to wake up the next day and have much better body or energy. On the contrary, about 1 to 3 weeks after having been to the gym, then you can start to realize all of the benefits in your body. Same exact thing with this therapy. It takes a few days or even weeks for your body to make the adjustments after the magnets have done what they've needed to do, in order for you to start noticing that, yes, I do feel better in certain issues that I had previously. So in summary, I've given an explanation of biomagnetism or biomagnetic pair therapy, which should not be confused with traditional magnetic therapy. Once again, biomagnetism involves the placement of 2 magnets to correct or balance pH issues in the body that will reestablish normal structure and function to our bodies. This therapy is once again practiced internationally around the world, and specifically in Chile and in Ecuador, where it is practiced by medical doctors in the hospital setting for nearly all health conditions. And the number of sessions will depend on each individual case.